the headlines. The National Online Training Conference on Professional and Technical Issues related to operation of the Fatherland Front and social political organizations at the new commune level. The inauguration ceremony of the Preclinical Research Center. The workshop on HIV infection prevention and creating bridges for PrEP. Hello, and it's good to see you back here in this edition of Continuous and Top News today. On June 14th morning, Ho Chi Minh National Academy of Politics presided over and coordinated with the Government Party Committee to organize the National Online Training Conference on Professional and Technical Issues related to party building and organization, state management, organization and operation of the Fatherland Front and social political organizations at the new commune level. The conference was broadcast online to nearly 11,000 locations nationwide with more than 1.5 million attendees. Delegates were presented with the following topics: party building and organization work, grassroots party organization, apparatus and activities of commune-level party committees, new points in the party's inspection and supervision work and functions, tasks and organizational structure of commune-level inspection committees, organization and activities of the Fatherland Front and political organizations at the commune level. Given the importance of the topics, the reporters requested that party committees and organizations at all levels focus on leading and directing the urgent and effective implementation, ensuring that the agencies and organizations of the political system under the new model operate smoothly and effectively, meeting the requirements. The training conference takes place in 2 days, June 14th and 15th. SIS Cần Thơ International General Hospital on June 14th morning held the inauguration ceremony of the Preclinical Research Center with a total investment of more than 25 billion Vietnam dong. The Preclinical Research Center, a key project, is built on a modern scale, including 3 operating rooms, vascular intervention, experimental anatomy, clinical skills training, meeting international standards. The animal monitoring rooms at the center are professionally designed according to international standards, meeting global research needs, with the ability to monitor long-term from 3 months, 6 months to 1 year with diet and medication similar to humans. In particular, this is a place to train and practice practical skills for clinicians such as surgery, procedural intervention, thereby helping to minimize the risk of complications for patients. Earlier on the evening of June 13th at Sheraton Cần Thơ Hotel, SIS Cần Thơ International General Hospital organized the Gala Dinner Stroke Intervention School 2025. The program gathered many special performances and spent time expressing gratitude to the reporters participating in the workshop to update knowledge and new techniques in stroke treatment and intervention. The program also aimed to celebrate the 100th anniversary of Vietnam Revolutionary Press. In particular, the program also had an exchange with Hollywood director Leland Arthur about his experiences when coming to Vietnam and sharing his feelings when coming to SIS Cần Thơ International General Hospital. The program also continued to launch a charity fundraiser for poor stroke patients in the Mekong Delta region. Here, organizations, units, and individuals supported with a total amount of 2,033,838,000 Vietnam dong and $1,200. With the aim of raising awareness, providing information about PrEP and other HIV prevention measures, and facilitating participants to receive counseling and connect with HIV prevention services, on the afternoon of June 13th, the Center for Disease Control, or CDC of Cần Thơ City, and Cần Thơ University of Medicine and Pharmacy jointly organized the workshop on HIV infection prevention and creating bridges for PrEP. In the context of HIV epidemic still having the risk of spreading, especially in high-risk groups, In recent times, CDC control has promoted direct communication, mass communication, group communication in the community, and create conditions for suspected and infected people to access medical testing services, assess effective preventive measures such as PrEP as one of the priority strategies, enhancing understanding, connection, and coordination of actions between sectors, levels, and communities in HIV/AIDS prevention and control, contributing to reducing new HIV transmission in the community and joining hands for a national goal of ending the HIV/AIDS pandemic by 2030. On June 13th, at Nam An Pagoda in Trung Thành commune, Cần district, Hoa Hảo Buddhist Representative Board of Cần Thơ City, in coordination with Hoa Hảo Buddhist Executive Board of Trung Thành commune, solemnly organized the grand ceremony to celebrate the 86th founding anniversary of Hoa Hảo Buddhism. Since the Congress of Hoa Hảo Buddhist Delegates for 2013-2024 term, the Charter of the Hoa Hảo Buddhist Center has been gradually implemented to meet the legitimate demands and aspirations for fellow believers. Social charity activities in the past year achieved over 512 billion Vietnam dong through building great solidarity houses, rural roads, giving gifts to poor people to celebrate the new year, collecting traditional medicine, processing herbs, and actively responding to the national target program on building new rural areas and civilized urban areas in the locality. At the ceremony, the leaders acknowledged the contributions of the officials and followers of Hoa Hảo Buddhism to the development of the city. Hopefully, in the coming time, the executive committee of the Hoa Hảo Buddhist Center and all Hoa Hảo Buddhists will continue to promote the strength of the great national unity bloc, carry out activities that benefit society, especially social charity work. With the spirit of bringing positive values to society, the Volunteer Blood Donation Advocacy Club of Cần Thơ City has been recognized for many years as a core force in voluntary blood donation campaigns, always ready to support and donate blood to save lives when needed.
Cần Thơ Voluntary Blood Donation Advocacy Club was established on June 14, 2016, and currently has 47 members, including students and officials from various associations, primarily the Red Cross Society. The club operates under the management of Cần Thơ Voluntary Blood Donation Steering Committee.
I believe that the humanitarian blood donation program is a meaningful activity that brings value to the community. This is my third time donating blood, and I always sign up whenever there is a blood donation drive. I think in emergency cases, having a blood bank is crucial because when a patient is losing blood, we need to save them as soon as possible.
This is my sixth time donating blood. The first time I went with my teacher, who frequently donates blood and was the one who inspired me to do the same. I hope that each drop of my blood can reach patients in need and help them overcome difficult times.
This is my 10th blood donation. For me, donating blood is not only about giving a part of my body, but also about sharing my spirit and faith with others. I hope that my blood can reach those who truly need it. People who also carry hope and belief so that they can use it effectively to overcome the challenges they face in life.
In response to the 2025 National Voluntary Blood Donation Day, Cần Thơ Voluntary Blood Donation Advocacy Club mobilized 150 members to register, resulting in an impressive outcome. Cần Thơ Hematology and Blood Transfusion Hospital collected 200 units of blood, 50 units over the initial target. After nearly 10 years of operation, the club has collected more than 10,000 units of blood, contributing significantly to the emergency blood supply reserves.
Since the beginning of the year, our hospital has faced many difficulties in mobilizing blood donations from Red Cross associations in the Mekong Delta region. This is mainly due to the recent administrative mergers of provinces and cities, which have left the Red Cross organizations uncertain about which unit to coordinate with. Blood donation activities to supply hospitals have also been seriously affected. As a result, the number of blood donation registrations from provincial Red Cross associations to hospitals has dropped by 50%.
With the massive drop of blood given a live share in the first quarter of 2025, Cần Thơ Hematology and Blood Transfusion Hospital received 32,011 units of blood from 48,951 registered donors, achieving a participation rate of 65%. Specifically, in Cần Thơ City, over 21,000 units of blood were mobilized since the beginning of the year, reaching nearly 51% of the annual target and significantly contributing to the emergency and treatment needs of patients in local hospitals.
The updated weather forecast also wrapped up this edition of Kênh News. If you want to watch again in its bulletin, please visit our website, kenthotv.vn. And thanks for being with us. Goodbye and see you next time.